through the dream of improving the health status of the people. The vision of rendering free healthcare services to rural communities around the ANIOMA environs was birthed. ANIOMA Medical Professionals Forum Incorporated, AMPF, is a reality that came through, born out of the desire to render medical help to the helpless individuals living around us and in our rural communities. The NGO is a non-profit, non-governmental health organization registered duly with Corporate Affairs Commission of Nigeria. The organization comprises of health professionals consisting of doctors, nurses, consultants, pharmacists, medical lab scientists, physiotherapists, all of ANIOMA origin, including those in diaspora. This honorable organization was birthed in 2014 by Dr. Awuno Alexander Chidubem, who is the founder of the NGO, who had the dream of improving the health of the people. The first program was held in 2015 in his hometown, Edumogo, with few medical volunteers present. As they say, charity begins at home.
AMPF, ANIOMA Medical Professionals Forum Incorporated, actually a non-profit, non-governmental organization founded in 2015. The reason for this movement or this organization is actually to see how the rural dwellers who don't have access to proper and good health facilities. AMPF is actually there to take this quality health care down to them at their various localities. It has actually been a success story so far from our journey from 2015 down to this time. It has been a turbulent one, but to God be the glory that we have gone this far.
Subsequently, the number of volunteers increased, and we have been moving from community to community to hold our programs. Every medical outreach that has been held by this prestigious body wouldn't have been possible without the selfless help of our medical professional volunteers, who work relentlessly to achieve the goal. They are not paid for their services, but they share in the vision of giving back to the society and rendering help to the helpless. Permit me to specially appreciate the pioneer volunteers who made this vision a reality. Dr. Okolie Kenneth Ekenechukwu, Dr. Stephen Ogbome, Dr. Stephen Isibo, Dr. Ogbugo Christian Chibuzo, Dr. Awuno Alexander Chidubem, and his lovely wife, Mrs. Awuno Chizumuwa, who has pushed the vision from the start.
My name is Dr. Okolie Kenneth Ekenechukwu. I'm currently the secretary of ANIOMA Medical Professionals Forum. I'm proud to say that I'm among the pioneer volunteer of this mission.
I'm Dr. Ibebunjo Teresa, a medical officer in the Department of Ophthalmology, FMC Asaba, a member of AMPF. I'm the leader of the eye care team.
Free consultation has been offered, medical treatment has been rendered, free lenses has been dispensed to patients that need it. Drugs have been dispensed for free. Surgeries have also been done for free, with all recorded as a success.
Apart from outreaches in collaboration with some international organizations, local organizations, government agencies, and other groups, sociocultural groups who have the same aims and objectives as we do. We have successful surgeries ranging from hernia repairs, ranging from dental surgeries, and other minor surgical procedures. We have eye examinations, we have dispensing of eye lenses, we have laboratory investigations being done, we have even physiotherapy care, everything, a comprehensive health care package giving back to our society.
So if we have a operation, we check your name about scan. So scan confirm on our of the courts now the private part. That will surgery why came in. So about we have so about me free, successfully.
I'm very happy for our children and our doctors from ANIOMA. So they give us the free medical treatment. So every one of us have free medical treatment, and even eyeglass, the tablets, any sickness.
On record, AMPF has visited about 40 communities with comprehensive healthcare rendered. Places covered are namely Idumogo, Asaba, Okpanam, Iseluku, Igbuzo, Iselazagba, Iselenkpitime, Asaba IDP camp, all the 18 communities in Aniocha North. AMPF has so far seen over 7,000 patients, with 65 free surgeries done, which were all successful. Over 3,000 lenses have also been dispensed, and tooth replacements and dental procedures carried out successfully. The first program was held in 2015 in his hometown, Idumogo, with few medical volunteers present.
In December 2016, we visited Oshimile South Local Government Asaba. This medical outreach was sponsored by Honorable Marapo. Honorable Member represents Anocha Oshimile in the Federal House of Representatives. Fast forward to April 2018. The Easter celebration was accompanied by a visit to Ibuzo community by AMPF, and at this event, over 1,000 participants were recorded, and hernia repairs, surgical excisions, dental surgeries were performed. In May 2018, we visited Iseluku community from the 18th through the 21st. The medical mission was sponsored by the Isile Association of North America, IANA. We recorded over 2,000 participants and 18 surgeries ranging from hernia, appendectomy, and etc. were carried out. On July 15th and 16th, Isile Bitime and Isile Azawa communities welcomed us through the support of the Isile Association of North America, IANA. We recorded over 2,000 participants in this outreach. And in October 6, 2018, the AMPF visited Asaba IDP camp and distributed toiletries, foodstuffs, and drugs to people residents in the camp who needed medical attention. Sometime in 2018, we carried out a successful surgery on a 48-year-old indigent patient diagnosed of pleomorphic adenoma of the left parotid gland. This surgery was fully sponsored by the Isile Association of North America, IANA, which covers Iseluku, Isile Asaba, and Isile Bitime communities.
Unfortunately, I can say that we have gotten about 95% assurance that all the branches are intact after the excision of the tooth. It was an excisional biopsy, so to say. I won't believe that.
And the patient was discharged home after she was certified fully fit by the attending surgeons. This marked a turnaround in the life of this patient. In November 2018, the AMPF flagged off a medical mission to reach out to 18 communities in Aniocha North, sponsored by Honorable Emeka Mobi, Aniocha North Rep DTHA, Aniocha Oshimile Federal Constituency. The outreach was divided into 3 phases, with 6 communities scheduled at each phase. The first phase was held on November 16th, where 850 patients were attended and 25 surgeries were carried out. The second phase was held from December 21st to 23rd with 950 participants and 20 surgeries, while the last phase was held at Onitsha Olona. 700 participants and 40 surgeries were recorded. The G15 Club of Obio partnered with AMPF to hold a medical mission in Obio community at the Obio Primary Health Center on the 27th and 28th of December 2018, and we had 800 participants in attendance. Also on the 22nd and 23rd of February 2019, Iseluku Association of North America, IANA, sponsored a 2-day free medical missions at Iseluku community, and this mission saw over 1,000 patients in attendance.
On the 11th of May 2019, we held another outreach covering Owa Alero communities in Ikanotis LGA of Delta State. 600 patients recorded on this medical mission. Ndokwa and Okwani communities were not left out. On the 21st to 22nd June 2019, we held an outreach at the Kwale General Hospital with attendance from Ndokwa, Okwane Aziz, with a total of 900 participants. The medical missions in 2019 was wrapped up with another visit to the Obio community on the 6th and 7th of December 2019, also sponsored by the G15 Club of Obio at Obio Primary Health Center. 610 participants were recorded.
Not forgetting the recently commissioned Pilgrim Baptist Hospital, Iseluku. It was commissioned with a massive medical outreach from the AMPF, sponsored by Prince Ibe Ozoma Foundation. This outreach was carried out on the 22nd and 23rd of February 2020. In this outreach, over 800 participants were attended, free lenses were given out, surgical procedures were carried out, amongst many other free health benefits.
These volunteers, we call them volunteers because these healthcare professionals are not paid for their services. These are young men and women who leave their place of comfort just to give out their time, their talents, and even their resources to see how they can help humanity. This is highly commendable because, you know, in this kind of society we live in, it's not easy for you to see something especially when you see the young ones trying to see how they can give back to society at no cost. So it's something very, very commendable, and that is what is so unique about this movement, and that is what has been surviving this group up to this time.
I joined this association in 2018, and I was very excited about joining it because I met a group of health practitioners with like minds who had the same vision to help the less privileged among our people. And from the beginning, we started out by giving out few medications, giving out treatments, but over time we have grown, and now we have done better. Before now, we could not afford to do surgeries, but now we are doing surgeries and several other things.
You need to come and see us when we come into these communities. The zeal, the enthusiasm these people have, the love for their own people is really astonishing. You see the joy in our clients, our patients, when they come around and we tell them this is what they are supposed to do. You just do this and do this, and they take a little medication and they are very, very okay. They are very fine, and you see the joy on their faces, as if you see the smile, the sign of relief. It's something really to behold. I remember very well the Obuzo of Ibuzo, how he welcomed us and how he hosted us in his palace. It was tremendous, enormous. He was overjoyed, and he told us that anytime we're ready to come, we're ready to walk in Ibuzo, he will always support us. I also remember we also went to Onichugbo, where the traditional ruler there hosted us in his palace to a feast, gave the volunteers food and drinks. That was really, really encouraging for us. And when we have this kind of appreciation, it makes us to do more and do more for both this community and humanity in general. Thank you very much for your support.
In the eye care section, we have been able to make diagnosis of different eye conditions. We have had people with refractive errors who before now would not have been able to afford certain treatments. For refractive errors, they need glasses to correct their problems. And we have taken glasses in their numbers to these people. And so far, I can say that we have been able to help over 1,000 people to get free glasses. Also, we have seen people with cataracts, we have seen people with glaucoma, we have seen people with several other eye diseases, people who would have gone blind if they were left unattended to. But our presence has made us diagnose such conditions, and we have referred them to the adequate quarters. And those who we could render help to on the field, we did that, and today they are better off for it.
Our website was also launched in 2019. The website also creates room for patients to be attended to online. We have medical professionals on alert, ready to take questions and render possible help. So far, the turn-up of visits to our website has been impressive. A lot of lives have been touched since the creation of this great organization. AMPF has facilitated the sponsorship of some spectacular surgical cases at tertiary healthcare institutions through partnerships with other non-profit charity organizations like the Isele Association of North America.
I want to appreciate the convener of this group, Dr. Alex Awuno. He has done a very fantastic job putting this group together. I know a lot of us have plans to bring something, give back to our community. But we cannot do it alone. We need to come together as a group to do that, which the convener has done so far. He has brought health practitioners from different sectors, and we have come together to give back to our community.
We call on health professionals from animal origin, both here in Nigeria and abroad, to come and join us to deliver these services free of charge to our indigent people. We're a non-profit forum, and we need support. Anyway, it may not be in money. You could give us, donate drugs, donate items, you could even give sponsor some of our outreaches. We'll be glad to do that. We take care of the feeding of the volunteers, take care of the accommodation of the volunteers. We really appreciate it. We want to thank the host communities, we want to thank the people of ANIOMA, we want to thank every other person, the government of Delta State, and everybody that has contributed in one way or the other to the success of our outreaches. Thank you very much.
We can't end this piece without giving special thanks to the Governor of the state, His Excellency Dr. Ifeanyi Ato Okowa, for giving us this enabling environment to carry out our programs. And also special thanks to the Honorable Commissioner of Health, Honorable Modi Ononye, for his fatherly counsel and support. Not also forgetting Dr. Ofilip, he has also been helpful to this mission. Special thanks to Honorable Joan Morabo, the then representative of the Aniocha Oshimile Federal Constituency, for her contribution towards the growth of AMPF. Special thanks to Honorable Emeka Nwobi for his sponsorship and partnership. Special thanks to Mr. Smart Ajaja for your donations to the crew. We also thank the corporate bodies we have worked with, the IANA, Isile Association of North America, AYUANA, Isiluku Association of North America, ANIOMA Association USA. Also, thanks to Honorable Emeka Nwobi for your partnerships. Thanks to Prince Ibe Ozoma Foundation and the G15 Club of Obio. Thanks to our able medical director, FMC Asaba, for his leadership and advice. I also want to appreciate our inestimable volunteers who have actually been the bedrock of this vision. Without you, this group wouldn't have been in existence.
We will continue to reach out and touch lives for a healthier ANIOMA community. AMPF is the future. AMPF has come to stay.